President Donald Trump told reporters he got every answer right on a cognitive test during his annual physical at Walter Reed National Military Medical Center on Friday. Speaking to reporters aboard Air Force One after the physical, Trump said he thinks he did well and that he believed the full report would be released Sunday. He did not share many other specific details from the exam, which was the first of his second term. He said the exam showed a good heart, a good soul, very good soul. He boarded Air Force One, headed to Florida shortly before 6 p.m. after spending about 5 hours at the hospital. I have never felt better, but nevertheless, these things must be done. Trump, who, at 78, became the oldest president to be sworn into office, posted on Truth Social earlier in the week. The public hasn't been provided a detailed look into Trump's health since 2018, and during the 2024 presidential campaign, he didn't provide any details about his health despite numerous promises to do so. White House Press Secretary Caroline Leavitt told reporters on Friday that the president's physician will provide an update on the report in the effort of transparency, adding, as many results as possible, and as soon as we possibly can. The summary of physicals traditionally provided is a narrative of the physical fitness that the patient allows to be shared. It has never been a full, transparent release of medical records. What Trump's last official presidential checkup revealed. In the January 2018 evaluation, Trump appeared to be in excellent cardiovascular shape for his age, according to then White House physician Dr. Ronny Jackson, who administered Trump's nearly 4-hour physical exam at Walter Reed National Military Medical Center. The president's medical issues were limited to high cholesterol, rosacea, a benign skin condition, and being considered overweight, as measured by body mass index, BMI. Trump's LDL cholesterol level was 143 milligrams per deciliter and total cholesterol level was 223 milligrams per deciliter. Total cholesterol should be less than 200 milligrams per deciliter. Trump's LDL cholesterol level, in particular, is significantly higher than normal, which should be less than 100 milligrams per deciliter. His BMI is calculated at 29.9 kilograms per square meter, using the National Institutes of Health calculator, which is just shy of the obesity classification, which starts with a score of greater than or equal to 30 kilograms per square meter. The 2018 report said the president takes a cholesterol-lowering drug called rosuvastatin, and because his cholesterol level was a little high, Jackson increased the dosage. Trump was also taking finasteride for male pattern hair loss. That medication can also be used to treat prostate issues. Trump also takes aspirin daily to prevent heart disease, a multivitamin, and applies a cream called ivermectin as needed to treat the skin condition rosacea. At Trump's urging, his physician conducted a brief screening test called the Montreal Cognitive Assessment. Jackson claimed Trump had a perfect 30-30 score. COVID hospitalization. In October 2020, Trump was hospitalized after he contracted COVID-19. Then White House Chief of Staff Mark Meadows said that Trump had a fever and his blood oxygen levels had dropped rapidly. Sources with knowledge of the situation told ABC News that Trump was having trouble breathing and was given supplemental oxygen. Doctors gave Trump an experimental course of monoclonal antibodies and steroids to treat him, and he returned to the White House after 3 days. Trump's health post-first term. Other than the letters from Jackson, the most recent accounting of Trump's health was a 3-paragraph letter from his personal physician, Bruce Ehrenwald of Morristown Medical Group, in which the doctor wrote that Trump's overall health is excellent. His physical exams were well within the normal range, and his cognitive exams were exceptional, Ehrenwald wrote. In addition, his most recent extensive laboratory analysis remains well within normal limits and was even more favorable than prior testing in some of the most significant parameters, most likely secondary to weight reduction. The doctor further explained that Trump's cardiovascular studies were all normal and cancer screening tests were all negative, claiming Trump had lost weight through an improved diet and continued daily physical activity. Butler assassination attempt. On July 13th, gunfire erupted at a Trump campaign rally in Butler, Pennsylvania, killing Trump supporter Corey Compertor and wounding Trump and 6 others, according to investigators. Trump's former White House physician and current GOP Texas Representative Ronny Jackson released a letter claiming that he had personally reviewed Trump's medical records from Butler Memorial Hospital, which Jackson claimed showed the former president was treated for a gunshot wound to the right ear. Jackson also confirmed that Trump underwent a precautionary CT scan while in Butler.